My dad was born in 1937 in Sohag, Egypt. He was one of 8 children. After studying medicine at Cairo's Ain Shams University, he married my mother Samiha in 1967. They moved to England, where my dad worked as a registrar in anesthesiology in Newcastle. In 1970, he was awarded his fellowship in anesthesiology at the Royal College of Surgeons. And later that same year is when he started his career at the Cleveland Clinic.
The workload was unbelievably heavy. I'm not quite sure why he came, and I'm not sure quite why he stayed, but he did. And the clinic profited by that. People respected him tremendously because he was very intelligent, very bright, could pick out the problems and could work on the solutions very quickly.
Hypertension was a problem, a major problem in terms of the postoperative cardiac area. So Fauzi worked with Dr. Tarazi, and they generated some very good research that looked at hypertension postoperatively and actually looked at ways to control hypertension.
"30 years ago, Dr. F. George Estefanos founded the world's first department of cardiothoracic anesthesia. About the same time, I became the head of the Department of Thoracic and Cardiovascular Surgery, so I worked with Fauzi for almost 3 decades.
We clearly couldn't have achieved what we did in cardiac care without cardiothoracic anesthesia. Dr. Estefanos was there from the very beginning. Fauzi conceived the idea of a special division of anesthesia to look after cardiothoracic surgery. He recruited the people, he set the protocols, he was instrumental in making the whole thing come together.
Dr. Estefanos gave anesthesia for the majority of my cases during my professional career, and he has lived to tell about it.
Fauzi and Fred Loop were interesting partners in many ways in watching them interact. However, one of the hallmarks of what happened was that they always got things done, and actually that was a very strong blueprint for both Toby Cosgrove and myself when we took over their leadership roles.
His guiding principles have made his department an integral and even inseparable partner in the #1 heart program in the world.
Another first for Dr. Estefanos was the initiation of an engineering group within the Department of Cardiothoracic Anesthesia.
Dr. Estefanos had the insight to see that technology was really needed and expanding in the ORs and brought people in to deal with those issues very quickly.
He was a driver behind developing a number of innovative systems, including the anesthesia medical record keeping system.
We built a lot of very special equipment for the Cleveland Clinic, and I'm glad that we did. Generally speaking, I'd have to say Dr. Estefanos, Fauzi as I used to call him, was dead right, and so was John Petrie.
From that group, we were able to provide technology and support directly in the OR, probably the only group in the country at that time.
One of the founders of the Cleveland Clinic, Dr. George Cairo, spent a lot of time, although he was a surgeon, he spent a lot of time studying pain and trying to help people with pain. Dr. Estefanos has the vision that pain is a huge field that we need to tackle from his early days in anesthesiology. And it is true, chronic pain is a major health issue.
He brought in some of the most recognized physicians in the world that had led advances in the field of pain management, and he built this program.
Dr. Estefanos wanted to have the Cleveland Clinic be the first major center in the country to have a multidisciplinary pain unit, because he recognized the fact that this was a very important endeavor for the United States and internationally.
He could see the value of training people not only in subspecialties but in branches of subspecialties in anesthesia.
He has promoted the development of such excellent tools as HealthQuest, ChildQuest, the preoperative algorithms and the PACE clinic impact concept to allow us to focus our attention to each individual patient and tailor anesthesia. And all of this has become the foundation of surgical success and excellent patient satisfaction.
The reason he was skillful was that he had a clear understanding of the dynamics of the operating room. He had a clear understanding of the psyche of the anesthesiologist, and as he was able to combine that with changes within the healthcare system and create something which serves the community well and serves the clinic well.
1995-96 was one facility. Currently we have 11 facilities in Northeast Ohio.
Hillcrest, Huron, Euclid, Marymount, Lutheran, Lorraine, Strongsville, Kaiser's, Parma's ASC, as well as Marymount's ASC. And so there clearly is a use and important need to combine the strengths that Dr. Estefanos had thought of.
He dealt with the changes of the emerging practice of anesthesiology, moving to the regional practice setting. And in the end, everything presented to him as a challenge, he ended up meeting.
Dr. Estefanos' vision all along was to put together basic scientists, clinical anesthesiologists, intensivists, pain management specialists to work together as a team.
Dr. Estefanos has always been a champion of research. Before he became division chair, the Division of Anesthesiology had about 50 publications in the peer-reviewed literature. And since then, we've had over 500.
His continuing support has been substantial and really essential to allow us to achieve our goal, which is really to be at the forefront of research in the discipline of anesthesiology, critical care medicine, and pain management.
He also built a great academic enterprise, one filled with basic and clinical research and superb education.
Dr. Estefanos established the first cardiothoracic anesthesia fellowship here at the clinic, and actually now has become the world's largest training organization for this particular subspecialty.
He relentlessly supported education over the years, and this is now reflected in the fact that we have the largest anesthesiology residency training program in the country with over 140 residents, fellows, and interns.
And we have the largest fellowship program, largest pain fellowship program in the country.
Became fully accredited with 5-year inspection intervals and has never looked back. The number of residents in research increased considerably. And I think as chairman through that period, he deserves a great deal of credit. And I would certainly thank him for his support, his understanding, and his direction.
It was his idea to create the Center for Anesthesiology Education. And I think at the point of his retirement, his department truly is one of the best in the United States, and it's totally appropriate that it's named after him in recognition of that accomplishment.